Wondermous. Welcome to a healthcare leadership journey, the podcast by Merikay Hunt, founder of Coach MKay Companies. I am super excited to feature leaders who are catalysts for positive, purposeful change. And today I have Rob Cavagnol, and he's going to be sharing a little bit about his leadership journey. So, Rob, to kick us off, share with people what inspired you to go into healthcare and share with them a little bit about your career journey.
Yeah, I'm happy to. So, my mom's a nurse, and my dad had a master's degree in pharmacology. So, the conversation around the dinner table was always focused around something healthcare related. My mom telling clinical stories, or my dad talking about, teaching. Really enjoyed the sciences, and there's different tracks that people can go down. Going into a lab and doing pipetting or working in pharma really didn't interest me, and so at a young age, I was drawn towards medicine, and I knew pretty early on that I wanted to go to medical school. My journey was took a little bit of a different turn. So I'm a general surgeon by training. I started practicing as a general surgeon, and I just wanted to see a lot of patients and do a lot of operations. And about 18 months into my career, a hallway conversation with one of the senior vice presidents convinced me to step into a leadership role. And I
Wow.
continued to practice clinically for quite a long time. But I did move more and more into healthcare leadership, and that's the journey that I've been on. Mostly focused on medical group leadership and with various health systems and in a bunch of different roles.
So that conversation was a pivotal moment for you. And I call those kind of God winks or aha moments. What was it that really centered in your mindset and your heart about making that shift and taking that step?
Well, I'll be honest. I spent the first 5 minutes of that conversation trying to talk that leader out of hiring me. It was a quality role, and I said, "Look, I don't really know anything about quality in healthcare." And the leader said, "Look, you've got the tools that I need. I can teach you the rest." And so I spent the weekend thinking about it, and I talked to my wife and came back on Monday and said, "Okay, let's see how it goes." And it's a different type of fulfillment. When you're a physician, you're helping the patient in front of you, and if they're suffering, then their family. But when you're in a leadership role and you can actually impact a broader organization or actually a community, it's just a different level of meaningful contribution. And so that's what I really enjoy doing. And as I took on increasing responsibility throughout a couple of different health systems and being able to see the impact that I was having through my leadership roles, that was really
Awesome. Well, and one of the things I learned about you when we first met was your involvement in the U.S. Navy. My father was actually a dentist in
well.
the Navy for a couple of years. So, share with me a little bit about what was powerful about that experience.
Oh wow. So I did my surgery training, and I went into the Navy as a practicing general surgeon, and I was stationed at Camp Lejeune, North Carolina. I deployed twice when I was with the Navy. Once on a hospital ship after Hurricane Katrina, devastated the southern states. And then the day I got back from that deployment, I was told I was going to Fallujah, Iraq. I'll tell you, in those situations when you're deployed and you're with a small group of people who are really reliant on each other, really taught me the importance of teamwork, mutual accountability, clear communication. There's just not room for mistakes in those types of situations, and so that really galvanized those things in my mind and the importance of them, especially in leadership. And so that probably was the spark that was smoldering in there for a while and sort of prompted me to move into leadership later in my career.
Wow. So that really made me think, was there like a incident that occurred among the team that things kind of went sideways and you had to sort of implement some strategies because you mentioned communication and teamwork, as vital components of that. Can you recall an instance where, there was some major issue and then you all had to kind of resolve it?
Yeah, so when I was in Fallujah, we had a limited number of personnel. So there were two surgeons and two anesthesia providers, and we had a couple of days where we had mass casualty events. So they brought us 9 or 10 wounded Marines. And so you have to quickly triage, who's most critical, who needs to go to the operating room first. Unfortunately, some were not salvageable, and so those moments and those days when you're in the operating room 10, 11 hours and you finish and you take off your boots and your socks and you've got blood between your toes, those are the days where the team really comes together, because it's really a difficult, stressful situation, and you're there together, and it really you form those strong bonds with those people that you work with.
Well, you mentioned 10 and 11-hour days, and one of my earlier guests um, talked about burnout, right? And how that is alive and well. And sometimes it's restrictions put on our caregivers now, because of red tape and processes and protocols and whatnot. But speak to that. What do you feel like you do personally, professionally, to combat burnout?
Yeah, there's several things that I do to maintain my own personal wellness and well-being. Really like to exercise. I've recently gotten into hot yoga, which I like to do sometimes with my wife, and it's just a great it's a great stress reliever. I do some meditation and breathing exercises. I use an app on my phone, and spend somewhere between 12 and 18 minutes doing that. I try to do it daily. I'm not as good as I should be.
Do
And
you know
then
the app that you can share with people, Rob?
I I use the Calm app, and the thing I like about it is you can download some of the meditations, so you can do them even if you're not connected to Wi-Fi, like on an airplane. But by the way, when it gets bumpy, I don't love that either, and so I usually go to my Calm app when it starts to get a little turbulent on the plane. So I love to meditate, and then I've got two really active dogs that really love exercise, and so I'll take them for a 5 or 6 mile walk. When I was living in Idaho, we'd go hike in the foothills, and so those were all things that I would do to maintain my own personal wellness and well-being. And then the other important things: getting plenty of sleep, eating right, all those other things that are important for your own personal wellness.
No, I'm glad you shared that because I'm kind of hyper. And years ago, I'm almost embarrassed to admit this, but I had to buy a book on meditation to learn how to do it because I do like quiet time, devotion time every morning. And what was interesting is just a few months ago, I discovered another app. It's called Boho Meditation. And they, have a little chime and they give you a statement. And it's interesting because it's 10 minutes. And I'm like, oh my gosh, leaders, we need to find 10 minutes to invest in ourselves every day to hit that reset button. So thank you for sharing some of your secrets of success.
There are some really interesting data out there regarding meditation. And as you said, it doesn't have to be 30, 45 minutes, 10, 12 minutes. And there's good data that shows benefit from that. And so if you can just spend some quiet time with your eyes closed, focused on your breathing, that'll do wonders.
That's great. And speaking of wonders, I'm curious who has been a wonderful influence on you, or who's somebody that's really kind of been a mentor to help you on your journey?
Yeah, I had a great mentor when I was with Mercy Health System. So the person who had the role, a couple leaders before me was a very senior surgeon, still with the organization in a system wide role, and I had the opportunity to meet with him about every 4 to 6 weeks, and
Wow.
so valuable just to sit down and say, hey, here's some things that I'm facing. Here's some challenges. How do you think about it? Did you encounter those when you were in the role, and what are the things that you thought about in the ways to tackle this? First of all, just having someone to talk to, right?
Absolutely.
Leadership can be lonely, and so having someone to share the struggles with, and then being able to bounce ideas off someone, and of course he wasn't there to give me the answers. He was just there to say, well, here's a few ways to think about it, or here's some things to consider, and here's some people to collaborate with. So incredibly valuable. And so mentorship, and coaching, feedback, those types of things, those have been extremely important to me and valuable in my growth as a leader.
Well, and as I've met different leaders in 25 years of working with different healthcare, um, practices and also working in the hospital, it's interesting because some leaders want to help others, some want to help themselves. And I think that's why I'm passionate about helping share people's stories because when you help other people, you help yourself too. And so, as you kind of look forward, you mentioned when we first talked that you're in a transition. Talk to me a little bit about that transition because you never know. Someone might be listening to us today and they may click with you, or something could happen in the future that this could be a catalyst moment. So share with me a little bit about your vision and what you want to see for the future.
Yeah, so I'm between roles, as you mentioned. The first thing that I did was to reach out to people in my network, people who I trust, people who I've worked with before, and just talked. And hey, here's where I am, and here's what I'm thinking about. A lot of these folks ask me really good questions. What are you passionate about? Where do you want to live? What kind of work do you want to do? What do you want to do going forward? And so several of those conversations have been extremely helpful to me to help sort of aggregate my thoughts and get a little bit clearer on what do I want the last couple of jobs in my career to be. And so I think, again, going back to the mentoring and the coaching and the feedback, getting input from other people and having them ask really good questions has been extremely helpful. So that was the first step of what I did. And then I want to be very selectful and intentional. Right. I don't want any role. I want a really meaningful role somewhere where I can join a team and really gel with the person that I work for and the team that I work with. So that's what I'm looking for. And again, I'm not in a rush.
Sure.
To me, what's the most important thing is it's the right role with the right organization and
And what
and
territory
surrounding.
are you in, Rob?
I'm sorry.
What territory are you in?
Right now, I live in Wisconsin.
Okay.
But I'm certainly willing to relocate and for the right opportunity. And so yeah, I'm looking nationwide.
That's awesome. Well, and I just saw a message this morning about visualization, right? The impact of sort of seeing where you want to go. And I think when we can capture what kind of team we want, what kind of leadership role we want, and we verbalize it and we share it, then there are some law of attraction things that potentially can happen where you just never know. I also call it designing or being the architect of your career, being the designer and the architect of your personal life too. So really capturing our strengths, I think, and maximizing those. So if I were going to ask you three or four of your signature strengths, what would you say they are?
Yeah. So things that I'm known for, the people that know me would describe me as having a strong bias for action. I'm not someone who sits back and I'm not a wait and see type of leader. I make things happen. I'm also a strong communicator, both written and verbal. I like to get in front of people. I like to connect with people, ask good questions, understand what's going on in their mind, and then share the intent of what we're trying to get done. I also really enjoy collaboration. I'm not someone who enjoys going it alone. I like to have the right team around me and relying on other people, bouncing ideas back and forth. I'm a huge believer in that's the way you're going to get to the best idea. And so I would say those are some of my strengths. Now, if you have a real strong bias for action, you just have to be mindful. You can't jump before the rest of the stakeholders are ready, and that's one of the things that I've learned throughout my career in leadership is that you got to bring people along with you. Otherwise, if you're too far out in front, you're just taking a walk. You're not really leading people. I think John Maxwell said that. But those are some of the things that I would say are my leadership strengths.
So on the idea theme, Rob, if you could change two or three things about healthcare, just wide open to make the processes better, the delivery of care better, anything. What are some ideas that you have to make positive, purposeful change?
I think healthcare for too long has been provider focused and needs to be more patient focused. And what I mean by that is, what's easiest and most convenient for the patient. if you think about something simple, like someone goes, on the online or on a website and fills out a form, and then they come into the doctor's office and we give them the same form to fill out, right? And they say, "Oh, I already filled that out." Yeah, but we need a different one, or something like that. I mean, we're just wasting people's time. And so, if we designed the health system and healthcare around the patient
Mm.
and thought about, how do we take the friction out of the system? How do we make things easy? How do we improve our communication with patients? I think that would just be huge. And I think of other industries that have had that focus, like banking, right? Or even airline travel gets a bad rap, but how easy is it to book a flight and change your flight and pick your seat and all the different things that you want to do?
Really?
That's hard to do in healthcare, right?
Yeah.
And so if we took a lesson from some of these other industries
Mm.
and we really focused on, hey, let's make it easy for patients. Let's make it easy for them to get care so they know where the right place to go is at the right time, and communicate back and forth about results and medications. I think there's just a huge opportunity there. So that'd be
Gotta
really
share
cool.
this. So one of Dale Carnegie's principle from How to Win Friends and Influence People is throw down a challenge. So I'm gonna throw down a challenge to you because I love that airline analogy, and I want you to consider writing a book. It doesn't have to be, it could be 100 pages, and pick some of those industries and see how you might apply it. You also made me think of a time when I went to my orthopedic office, and this was in Greensboro, North Carolina, and I did not like the way that the assistant was taking notes because her back was to me. And I videoed her. So this is like my little catalyst moment that I had. I videoed her and then I shared it with the practice administrator because if she would have just turned around, her station easily could have been modified. And it also happened a few years later when I took my daughter to have her wisdom teeth out. The nurse was giving the post-op instructions with her back to us. Little things like that can also have an impact in the patient experience. So, thank you for sharing your ideas. So, when you think about kind of your opportunity to be that catalyst for change, was there a defining moment where you saw some change and maybe you were not able to help, or maybe you were able to help and it became successful? Can you think of a time and give an example of that?
Gosh, I've talked with so many patients over the years. I was very busy clinically for at least the first 8 or 10 years of my career. And so many patients talked about, hey, I got great care. So thank you for the wonderful care that you provided. But, and it would be a billing issue. I can't get the right person on the phone, or I didn't get the results, or whatever it was. I've just
Yeah.
heard from so many patients, anecdotal experiences that made it really difficult. And you know, way too often I kind of shrugged and said, "Yeah, that's kind of the way the system works." And yes, it is frustrating not being able to change all of those different elements. And there's so many reasons why, right? There's complexities with different insurances and the way that pricing is and billing and all these different things. It's just way overly complicated.
Right.
The U.S. healthcare system wasn't designed. It's just a patchwork of the way that things kind of shook out. And so if we could just scrap it and start over and design it with the patient at the very center,
Mm.
and say, look, our job is to make things easy and effective and efficient for the patient. Now let's build it around them. That I think we would come up with a much better system. So yes, I've had a tremendous number of those anecdotal experiences where people again are grateful for the care that they
Right.
receive, but unfortunately the experience is tainted by something like I just described.
So here's a possible title for you: The Patchwork of the US Healthcare System.
All right, I'm
Then the
after. I'm gonna
title:
write this down.
Creating Amazing Change.
There you go.
So, and speaking of change, if you were going to talk to your younger self and give yourself some words of wisdom, what would you say?
Yeah, I think I've been relatively ambitious in my career and relatively bold, but certainly there were times that fear gets in the way.
Mm.
That you're either afraid of failure, or you're you're not sure about taking that next step. And I would say, most of us, when we get to the end of our life, when we look back, the things that we regret are the opportunities that we didn't go for or the chances that we didn't take. And so I would just encourage my younger self to take those opportunities and to take those chances because, again, we don't typically regret trying and failing. What we
Right.
regret is not trying at all. So, to my younger self and to other leaders out there, I would just say be bold.
Be bold. I love it. Thank you, Rob. This has been an honor and a pleasure to talk with you today, and keep visualizing that dream job, that dream team, and I believe it'll come to pass.
Thanks so much for having me, Mary Kay. I enjoyed it.